The termination notice was still sitting on the hospital administrator's desk when Reed Calloway walked out through the sliding glass doors for the last time, carrying nothing except a worn canvas bag and the small yellow raincoat his 8-year-old son had left in the break room 2 weeks ago when he'd visited during a slow Tuesday shift. Behind him, colleagues whispered that he'd finally cracked. Some said the pressure had gotten to him. Others said he was throwing away 17 years of loyalty over something that could have been handled quietly, internally, the way things always were, at Mercy General. But none of them knew what Reed had been carrying for the past 3 years. None of them saw the notebook he kept in his locker, the one where he tracked Sam's school events so he wouldn't forget them, only to miss half of them anyway. None of them were there the night his son called the hospital's main line because Reed's cell phone had died, and Sam had woken up from a nightmare and didn't know what else to do. He was 9 years old, and he called the hospital, not because he thought it would work, but because that's where his father was. Reed had spent 17 years as a charge nurse in the cardiac intensive care unit. He knew the sound of a monitor flatlining before the alarm registered. He could read an EKG the way most people read a text message. He remembered patients' names, their children's names, what they were allergic to, what made them laugh when the pain got bad at 3 in the morning. The doctors trusted him. The patients asked for him, by name. And when the hospital's new ownership group came in 18 months ago talking about efficiency metrics and staffing ratios, Reed was the one who raised his hand in every meeting and said, quietly but clearly, that the numbers didn't account for human beings. That was the beginning of the end, though he didn't know it then. His wife, Laura, had died 31 months earlier from an aggressive form of ovarian cancer that moved faster than anyone predicted. They had 8 months between diagnosis, and the last morning, Reed sat beside her hospital bed, holding her hand, while Sam slept in the chair. In the corner, his small sneakers still on, his head tilted at an angle that would have made his neck hurt when he woke up. Laura had made Reed promise 2 things before she stopped being able to talk. That Sam would always know he was loved, and that Reed wouldn't spend the rest of his life just surviving. Reed had kept the first promise. He wasn't sure about the second. After Laura died, every morning became a kind of logistics problem to be solved before the sun was fully up. Reed woke at 5, packed Sam's lunch. Always a turkey sandwich, always with the crusts cut off, because Sam had decided at age 6 that crusts were aggressive, and nobody had found a way to argue with that. Got him dressed, dropped him at school by 7:15, drove to Mercy General, worked 12 hours. Picked Sam up from the after-school program if he was lucky, or called the neighbor Mrs. Patel to get him if he wasn't. Then dinner, homework, bath, bedtime, and 2 or 3 hours of charting from the kitchen table before he did it all again. He told himself temporary, that things would settle, that the hospital would find its footing under the new ownership and everyone would stop being afraid. Instead, the staffing cuts came. Then the mandatory overtime. Then the new policy that required nurses to document patient interactions in real-time tablets, while also, somehow still touching the actual patient. Reed filed a formal complaint. Nothing happened. He filed another. A supervisor called him into her office and told him, with a practiced smile, that the hospital valued his commitment, but that adaptability was also a core competency. The word lodged in his chest like a splinter. He requested a schedule adjustment 3 times over the following 4 months, so he could be at Sam's school events, a science fair, a holiday concert, a father-son breakfast that Sam had mentioned so casually. Reed almost missed the weight behind the words. Each request was denied with a form email. The holiday concert happened on a Thursday evening. Reed was in a mandatory staff meeting he hadn't been notified about until that morning. He called Mrs. Patel from the parking lot at 9:15. She told him Sam had been fine, had performed his part, had looked for Reed in the audience the way kids do, scanning faces, and then simply looked back at the stage and kept singing. That was in November. In February, a patient Reed had been advocating for, a 63-year-old man named Harold, who'd had 2 cardiac events in 3 months, and needed a specific follow-up protocol that the new system kept dropping, was discharged early because his insurance authorization ran out. Reed escalated it. He went above his supervisor. He sent emails to the department director, and then to the chief nursing officer. He documented everything. 2 weeks later, Harold was back in the emergency room with a third event. He survived, barely. And Reed was pulled into a meeting, where 3 administrators in business casual clothing told him that he had created a hostile communication environment by going outside his chain of command. He sat very still while they talked. He looked at the institutional carpeting and thought about Laura's last promise to him. He thought about Sam on the phone, calling the hospital's main number, not knowing what else to do. He resigned the next morning. He didn't raise his voice. He didn't make a speech. He wrote a 2-paragraph letter, left it on his supervisor's desk, and walked out through the sliding glass doors before 7 a.m., with the yellow raincoat under his arm. If you've ever left something that was eating you alive and still felt like a failure walking out the door, then you already understand exactly where Reed was standing in that parking lot. If this story speaks to you, take a moment to share it with someone who needs to hear it today. And subscribe to Dignity Tales for more stories about ordinary people doing extraordinary things. The first 2 weeks were the quietest Reed had experienced in years. He slept past 6. He made Sam breakfast without watching the clock. They walked to school together, actually walked. Not rushed, while carrying 3 bags, and Reed noticed for the first time that his son had started narrating the things they passed, the way small children do when they have the space for it. A dog wearing a sweater. A cracked sidewalk that looked, Sam said very seriously, like a map of a country that didn't exist yet. Reed had laughed at that, real laughing, the kind that surprised him. But the silence at night was harder, the apartment that had once felt too full. Laura's books still on the shelves, her reading lamp still by the chair, her handwriting on the grocery list pad she'd never finished. Now felt like a space that was waiting for something. Reed didn't know how to give it. He picked up freelance work through a nursing staffing agency. Per diem shifts here and there, enough to keep the bills from becoming emergencies. He was good at it, and he knew it, and patients responded to him the way they always had. With a kind of immediate trust that some people have for nurses, the way they have for certain strangers on trains. He had that quality. Laura had called it his gravity. She said people just moved toward him without meaning to. Sam started sleeping through the night again. Reed noticed it at the end of the 3rd week. He'd been waiting for the sound of Sam's feet on the floor, the small shape appearing in the doorway the way he had most nights since Laura died. And one morning he realized he couldn't remember the last time it had happened. He stood in the kitchen with his coffee, and didn't say anything, because there was nobody to say it to. But the feeling was something close to relief, and something close to grief, at the same time. And he let himself stand there with both of them for a minute before he started making the sandwiches. The financial reality arrived on schedule, the way it always does. Savings are not infinite. Per diem work is not a plan. In the 5th, Reed sold the good camera he and Laura had bought for a road trip they were always going to take, and in the 6th week, he called his older brother in Portland, who offered to lend him money in a tone that was kind, but had a current of something else beneath it. The particular discomfort of watching someone you love make choices you don't entirely understand. Reed thanked him and said he'd think about it. He was still thinking about it. It was a Tuesday afternoon, 3 days after that call, when Margot Hale walked into the community clinic, where Reed was covering a shift for a colleague who'd called in sick. He didn't know who she was, that's worth saying clearly. He didn't know her name, or her title, or that she had spent the last decade turning a mid-sized regional hospital network into one of the most watched healthcare organizations in the country. He didn't know that she'd been profiled in 3 national publications in the past 2 years, or that she had a reputation in boardrooms for being precise and relentless, in a way that made people use the word brilliant when they meant to say intimidating. What Reed knew was that she came in with a laceration on her forearm from a kitchen accident. She said it matter-of-factly, the way people do when they're embarrassed about something small, and that she was watching him while he worked, not in an odd way, but in the way that people with very alert minds watch things they find unexpectedly interesting. He cleaned the wound and closed it, and talked to her, the way he talked to everyone. Not performing kindness, just extending it, and asked her if she had someone at home who could check it that evening. She said she lived alone. He wrote down the signs of infection on the back of a clinic card in his actual handwriting, the way he'd done for 1,000 patients before electronic systems made handwriting unnecessary, and handed it to her. She looked at the card for a moment longer than necessary. "Do you work here full-time?" she asked. "Today I do," he said, and moved to the next patient. She left without saying anything else. He didn't think about her again until 10 days later when she came back to the clinic. Not as a patient, just to ask whether he had a few minutes, which was a sentence that can mean almost anything. Her name was Margot Hale. She was the president and CEO of Halcyon Health, which had recently acquired a majority stake in 3 hospital networks in the Mid-Atlantic region, including, and this was the part she said carefully, watching his face, Mercy General. Reed was quiet for a moment. "I know," she said. "That's not a coincidence." She'd heard his name from the chief nursing officer at Mercy General, who'd mentioned him during a performance review audit. Not as a problem, exactly, but as a data point. A 17-year employee with an exemplary record who'd resigned without negotiation. Margot had a habit of pulling that thread. She asked what had happened. The nursing officer gave a version that was technically accurate, and completely incomplete. Margot had done her own asking after that. What she found was a pattern she'd seen before and was tired of seeing: an exceptional clinician. The kind institutions are built around, quietly exhausted out of the system, while the paperwork kept perfect score. She'd been planning to request a meeting with him through the staffing agency. Coming into the clinic on Tuesday had been her way of seeing who he was before she made that call. "That's a fairly significant amount of premeditation for a laceration," Reed said. Something shifted in her expression, not quite a smile, but the beginning of one. "It was a real laceration," she said. "I know. I closed it." He told her no, politely but clearly. He said he appreciated that she'd looked into the situation and that he understood what she was offering. A consulting role, initially, advising on nursing culture and patient advocacy protocols across the network. But that he was done being the person who raised concerns in rooms where the walls were made of glass, and the carpet cost more than his car. He said he had a son who was finally sleeping through the night, and he wasn't interested in trading that for a title. Margot listened without interrupting. Which not everyone does. She left. Reed went back to the shift, but the conversation stayed with her in a way she hadn't expected. Margot Hale was not accustomed to being told no, and she was not accustomed to caring about it after the fact. She was accustomed to outcomes, to leverage, to finding the right angle on a problem. What she was not accustomed to was sitting in traffic, on the way back to her office, thinking about a community clinic and a handwritten card. She had built her career on a very specific premise: that healthcare was ultimately a resource allocation problem, and that solving it required the clarity to make decisions that felt hard in the moment, but produced better results, in aggregate. She believed this. She'd staked 15 years on it. The handwritten card bothered her in a way she couldn't categorize. She went back to the clinic the following week with a technical question about cardiac monitoring protocols that she absolutely could have answered herself. Reed answered it, recognized what she was doing, and answered it anyway. They talked for 20 minutes. He asked her why she went into healthcare administration rather than clinical work, and she told him the truth, which was that she was good at systems and bad at sitting with uncertainty. And clinical medicine is mostly uncertainty. He said that was the most honest thing he'd heard from an executive in 17 years. She said that was a low bar. He said yes. Over the following 3 weeks she found reasons. She was aware she was finding reasons. She brought Sam a book about space from the hospital gift shop one afternoon, when she came to meet Reed after his shift, because she'd overheard him mention that Sam was obsessed with the solar system. And Sam looked at the book and then at her and said, with complete sincerity, "Did you know Pluto is technically still a planet in some countries?" And Margot said she did not know that, which was true. Sam decided she was acceptable. She and Reed did not talk about what was happening between them. They talked about everything else: his wife, her father who'd raised her alone after her mother left, the specific loneliness of being competent at something that requires you to keep other people at arm's length. One evening, after the 3 of them had eaten dinner at Reed's kitchen table during a power outage with 2 candles and a flashlight, and after Sam had fallen asleep on the couch, with the space book open on his chest, Margot told Reed something she had not said to anyone. She told him that she had structured her entire life around never needing anyone, because needing people had always ended with her standing in an empty room. Her father had worked himself half to death to give her everything, and died before she could give any of it back. She had married briefly in her early 30s. A good man, she said, a genuinely good man, and she had left because she didn't know how to be chosen without waiting for it to be taken away. She said this the way people say things they've rehearsed in the dark, without meaning to, the truth that lives just under the surface of every decision you think you're making for rational reasons. Reed sat with it for a moment. Then he said he thought the difference between surviving and living was whether you let yourself be seen when things were broken, not just when they were working. He said Laura had taught him that. He said he was still learning it. Margot looked at her hands. I think I've been running a very efficient operation, she said. That has no actual center. The crisis, when it came, arrived in the form of a board meeting that Margot had been preparing for over 6 weeks. A proposed merger with a national health system, the kind of deal that gets written about, that becomes a case study, had hit a structural problem in its final phase. The clinical integration model at the core of the proposal had a flaw that her team had missed, and that the opposing counsel had not. It wasn't a fatal flaw, but it required someone who understood both the clinical workflow and the administrative infrastructure at a level almost nobody did. Her deputy suggested bringing in a consulting firm. It would take 10 days and cost more than the clinic's annual budget. Margot called Reed. He listened to the whole thing. When she finished, he said, "You know I'm going to have to come into the building." "Yes. The building with the carpet. I had it replaced," she said, "last month. It was overdue." He was quiet for a second. "I'll need full access to the workflow documentation. And I'm not coming in before 8 because Sam has a thing at school." "What thing?" "A geography presentation. He's doing Pluto. Pluto isn't a..." "I know, he knows. He thinks the controversy is more interesting than the planet." She helped him figure out the presentation the night before. Not the content, which Sam had entirely under control, but the visual layout, which Sam had arranged in a way that was accurate and somewhat alarming. They sat at the kitchen table with the laptop between them while Reed washed dishes, and Sam explained his theory that Pluto's reclassification was mostly political, like a lot of things. Margot told him that was a sophisticated. Sam said he'd heard it from a podcast. She said that still counted. Reed looked at them from across the kitchen and didn't say anything. He spent 4 days working through the clinical integration problem with Margot's team. He found the flaw. He also found 2 others that nobody had caught, outlined a revised model, and presented it in a meeting that the board's legal counsel described afterward as the clearest clinical framework presentation he'd heard in 23 years of healthcare law. Reed thanked him and asked where the coffee was. The merger moved forward. Afterward, Margot stood in the conference room after everyone else had left, and asked Reed what he wanted. Not professionally though, that too. She asked what he actually wanted. He said he wanted to go back to nursing. Not administration, not consulting, actual nursing, in an actual unit, with actual patients, but with a schedule that meant he was home for dinner, and didn't miss geography presentations, and with the ability to escalate concerns without writing into a void. He said he wanted to be useful without disappearing. She said she thought she could do something about that, but she came to his apartment that evening anyway. Not for the answer, she already had it. She came because it had been a hard week, and she was tired in the way that power doesn't protect you from. And she knew that Reed's kitchen at 7 o'clock, with Sam arguing about whether cereal counted as dinner, and the light coming in sideways through the window, was the only place she wanted to be. She stood in the doorway for a moment after he opened it. She had her work bag over one shoulder, and her coat was still on, and she looked, for just a second, like someone who had been very composed for a very long time, and was no longer entirely sure what to do with her hands. "I don't actually need to discuss the contract," she said. "I know," Reed said. Sam appeared from the hallway holding a bowl of cereal. He looked at Margot, he looked at his father. "You should probably come in," Sam said. She came in. There was no dramatic declaration that night. No moment scored for maximum effect. What there was: 3 people at a kitchen table, 2 of them eating cereal because it turned out Reed hadn't gone to the grocery store, and one of them explaining that Pluto's orbit is technically more elliptical than circular. Which means it's not so much a small planet as a rebel, which Sam said like it was the most reasonable thing anyone had ever said. Reed went back to Mercy General 6 weeks later, but on terms that had been negotiated in writing by someone who actually read contracts now. He ran a pilot program for flexible scheduling in the cardiac unit. He co-chaired a patient advocacy committee that had actual authority rather than advisory status. Nurses who'd been quietly burning out started coming to him. Not because he had power, but because he'd proven that the building would not collapse if someone told the truth inside it. Margot restructured the nursing leadership model across 2 of the 3 networks, based on what Reed documented. Not because she owed him anything, because it worked, and because she was, at her core, a person who followed evidence, even when the evidence made her uncomfortable. They did not move in together quickly. They moved in together slowly, the way people do when they have both been broken by speed, when they know that the point is not to arrive, but to be present for the arriving. Sam wanted to know if Margot would still come to his school things, even if she was busy. She said yes. He said she could always check his presentations if she wanted. She said she would hold him to that. On a Sunday in October, almost 14 months after Reed walked out of Mercy General, with a yellow raincoat under his arm, he stood in the backyard of a house that was slightly too big for 2 people and exactly right for 3. Watching Sam try to explain the orbital mechanics of Pluto to the neighbor's dog, who was patient about it. Margot came out of the back door with 2 cups of coffee and stood beside him. She didn't say anything for a while, neither did he. They had gotten very good at that, at the particular ease of silence that means you're not waiting for anything. He's going to make that dog understand, Reed said. I believe him, she said, and that was it. That was the whole thing. Not a single extraordinary moment, but an ordinary afternoon that felt, for the first time in longer than Reed could easily say, like something he was living rather than getting through. Before this story ends, consider this. Harold, the patient Reed fought for at Mercy General, sent a card to the hospital 7 months after Reed returned. He'd completed cardiac rehab. He was gardening again. He said he wanted the nurse with the good handwriting to know. The card sat on Reed's desk in the unit for the rest of the year. Some people leave a mark by staying loud. Others leave it by refusing to disappear quietly when it mattered. Tell us in the comments. Have you ever walked away from something that was costing you more than it was giving you, and was it the hardest or the best thing you ever did? If this story stayed with you, share it with someone who needs to hear it today. And subscribe to Dignity Tales for more stories about the people who keep going. Not because it's easy, but because love, in the end, is always worth the cost.